And you're now live.
Okay. Well, thank you everybody for joining us today. Before we get started, we'd like to begin with a brief message from Gilbert Martinez from our communications staff for our Spanish-speaking viewers. Gilbert?
Buenas noches y bienvenidos a la sesión informativa. Esta sesión informativa se está transmitiendo en vivo por nuestro canal de YouTube para interpretación al español. Para escuchar la versión en español, puede usar el link de YouTube que se encuentra en la página de Facebook del Condado de Sonoma. Gracias. Y ahora regresamos para atrás con Paul Gullickson.
Thank you, Gilbert. I'm Paul Gullickson, Communications Manager for the County of Sonoma. Welcome to our joint community briefing with the Sonoma County Office of Education and the County of Sonoma for Wednesday, May 26th. The focus of our briefing today is youth vaccinations in our community. We will cover how the vaccination rollout is going and how parents can get their children ages 12 and above vaccinated. But the main focus tonight is to answer your questions. Questions you may have about the vaccines, where to find them, how they work, and most importantly, how safe they are. We encourage you to pass along your questions to us and our panelists by either emailing them to communications@scoe.org. Once again, that's communications with an S at scoe.org. Or you can just leave them in the comments area of the Facebook Live or YouTube live stream that you are now watching. We will collect all these questions and pose them to our panelists a little bit later. First, let me introduce you who will be posing those questions. Our co-moderator for this evening, Jamie Hansen, Director of Communications for the Sonoma County Office of Education. Jamie.
Good evening, everyone. Thank you for hosting this tonight.
Yeah. And now let me introduce our other panelists this evening. We have with us, we're very honored to have Sonoma County Superintendent of Schools, Dr. Steve Harrington, Sonoma County Health Officer, Dr. Sundari Mace, Dr. Irmela Shendi, endocrinologist and county immunization coordinator. Harrington, for an update on some of the vaccination clinics that the Office of Education have been holding. Dr. Harrington?
Thank you, Paul. First of all, I want to thank all the parents who have been bringing their children into the vaccination clinics, and in fact, bringing other family members along with them. And it is a family event where you can come into the clinics and get your vaccines. Many of the clinics are on school sites, and the reason they're at school sites is because they are a part of our civic community local agency. The state of California has looked at schools as part of the civic center for the neighborhood. And because of that, they're trying to centrally locate these clinics in schools for that purpose. One of the biggest things that have been a success is the joint participation between the county office and the county government center is the vaccination clinics that we did run for teachers. We had over 17,000 people we had to vaccinate, and with the cooperation of our outstanding school nurses and a partnership with Safeway and with the health clinics in Sonoma County, we accomplished that. We're now looking and turning our energies to our youth, because our youth, we realize going forward for a fall opening, we need to have as many students as possible vaccinated. So the county office is partnering with Safeway once again to host numerous clinics throughout the year. And I'd like to share with you what those next clinics are. Sonoma Valley, which is tonight at 7 o'clock, is going right now. McDowell Elementary in Petaluma is tomorrow night from 4 to 7 for families. Lawrence Jones Middle School is Tuesday, June 1st from 3 to 7 p.m. And we have a curative clinic, once again, coming back to LC Allen on Saturday, May 29th from 12 to 6:30 p.m. So that's what we have on the forefront right now. But we are very excited that our students are getting vaccinated. And for those of you parents who have your children involved in sports, we understand one thing. If they're vaccinated and there's an outbreak within a team, they still get to participate. because they don't have to be isolated. And I think many parents are finding that to be quite beneficial. So once again, we want to encourage all our youth who are participating in summer camps, in sports leagues, to get vaccinated. Thank you.
Great. Thank you. Thank you, Dr. Harrington. We look forward to hearing more from you. Let's, for an update on the county's vaccination efforts, let's go to Dr. Shende for a quick update, and then we'll go to Dr. Mace for an update of where we stand in our cases.
Okay, thank you, Paul. If it's okay, I'm just going to share my screen and just discuss a few things. It might be helpful for people to know where we are in the county in terms of our vaccination status, our rates right now, because I know many parents might be quite busy parenting and taking care of remote learning as well as hybrid learning and working at the same time. So let me just try to share my screen and review a few bits of data. Can you all see that? Can you see that, Paul?
Yes.
Okay.
Yes, it looks good.
Great, thank you. Okay, so as of yesterday, actually, Sonoma County had administered 535,000 doses, and actually, as of today, it's up to 549,000 doses total. And of those who are fully vaccinated, we're actually at 70%. That includes children over the age of 12. So just to be clear, that's a goal that the president had wanted to achieve for the country by July 4th. So we are already there in terms of 70% of the population having received at least one dose. So that is very exciting. That does mean that 30% have not received a dose yet. So we will get into that in just a minute. So in terms of what age groups have been vaccinated so far, so as would be expected, the over 70 population got a head start. And so at this point, over 90% of them have had at least one dose of the vaccine. And we can see the demographics as we get to younger ages. And basically, there's kind of a difference coming at about the age 40. So those who are under age 40 have significantly less vaccination rates at this point, which again is understandable because 20 and 30-year-olds were the last group to become eligible for vaccines. And in addition, this 12 to 15-year-olds just became eligible about 10 days ago. So these are groups that currently are not only eligible, but there are many people who remain to be vaccinated. Helpful to know too that all age groups now have a test positivity of less than 1%, except for the 18 to 24-year-olds for whom the positivity rate is starting to go upwards just a bit. And we'll get into some details about that in a minute. So in terms of race and ethnicity, at this point, about 54% of the Latinx population has received at least one dose of the vaccine. And in terms of the white, the Asian, and the African-American population, they're all pretty equal in terms of roughly in the mid to high 60% range. So this is another issue that we're looking at to try and address populations that may not have had as much vaccination administration at this point. So young people so far, as well as those populations that have a little bit less in terms of vaccine rates. So this next slide shows where we are in terms of who's actually getting infected with COVID at this point. So I'll turn that over to Dr. Mace to discuss some of these issues.
Great, thank you so much, Dr. Shende, and thank you to Paul and Dr. Harrington and others and all participants. I just want to start off by saying that we have done quite well. We've been right on the cusp between the orange and the yellow tier for a very long time, probably for really the past 6 weeks or so. So we had gone into red, and then very quickly we went into orange. But we're sort of in that threshold between orange and yellow. Our case rate, unadjusted, has been somewhere around 2.4 or 2.5 cases per 100,000 per day, which is much lower than it was at the height of the pandemic. And our test positivity overall has been less than 1%, the latest being about 0.7%. And our test positivity in that lower HPI group has been somewhere around 1.2% to 1.4% over the past month. So we're actually, those two test positivities are actually in the yellow tier metrics. And what's been holding us back is the adjusted case rate of somewhere around 2.2. We did make it into the yellow tier metrics for 1 week. The good news is, whatever happens in terms of these tiers as of June 15th, the state is actually going to do away with the blueprint for a safer economy, and we're not going to have a tier system any longer. And largely, many things at that point will be reverting to not being under restrictions or orders, and we'll have more specifics in the state usually. So where are our cases coming from? And what is the source of infection? That is important because we are remaining in the orange because of cases largely due to unvaccinated individuals. In fact, the majority of cases are now happening in this group. And since, as Dr. Shende just pointed out, we've done a great job vaccinating the people who are over 65 and other adults, it's really in the younger age groups that we're seeing more cases, and also due to gatherings. So younger, unvaccinated individuals gathering. That's kind of where our cases are coming from, the large majority of cases. As we've always seen throughout the pandemic, household transmission is where the majority of transmission is occurring. But we've also noted gatherings, and we continue to see cases from gatherings and travel. And that's travel outside of the state and within the state. And those are the primary contributors right now for transmission. So I'm going to turn this back over to Dr. Shende to complete the presentation.
Thanks, Dr. Mace. So this next slide I wanted to share with you just to show locally what has been happening when a certain portion of the population has actually become quite vaccinated. And that happened early on in this pandemic, or rather the vaccination rollout in the elderly population. So we looked at the data from those who lived in elder care facilities. And as you can see, we had two spikes. Back at the end of the summer, we had a significant spike in about August or so. Things quieted down. And then there was another one, as we know, in December and January. These are cases among residents and staff at senior residential care facilities. What's really interesting is to see what happened within 2 weeks of staff and residents being fully vaccinated. We see that there were cases all throughout, starting in about roughly May or so, May or June. They crept up, they went down a little bit, they crept up again, but they've never been as low as once we achieved 85 to 95% of the population being vaccinated. And at that point, it just completely goes down to negligible numbers of cases. And you know, for most of us in our lifetimes, we haven't seen this kind of an effect of vaccination. Some people may remember what happened with polio back in the late 50s, where similarly, many people, especially children, were very, very affected by it. They developed paralysis or they developed death from respiratory issues. And the vaccine came along and suddenly this scourge was really eliminated. Similarly, this is one of the first instances in our lifetime of seeing a vaccine and the effect of restoring health and some sense of normalcy. So other details, so no new resident cases have been diagnosed since March 5th in these elder care facilities, and there haven't been any resident deaths since February 16th. So then that brings up the question, we'll go from one end of the age spectrum to the other. So that's what happened in the elderly. So why do we want to vaccinate 12 to 15-year-olds? Well, there are a few reasons. So, you know, the focus has really been on the elderly population, and rightly so, because they did constitute the majority of the morbidity and mortality. However, in the 12 to 15 age group nationwide, there have been over 3 million cases of COVID and greater than 16,000 hospitalizations and 316 deaths so far. The hospitalization rate was higher than that from the flu outbreak in 2009, which is a really bad flu year. So even though, again, the hospitalization rates for children were not nearly as high as they were for adults with COVID, it still was significant. There's also a condition called multi-system inflammatory syndrome in children. It's a mouthful, but what it refers to is an inflammatory condition that can occur. And we had 3,700 cases nationwide and a few here in Sonoma County and quite a few in the Bay Area. And a lot of these cases, if they affect teens and adolescents, it's quite severe. 60 to 70% of these cases end up in the ICU. There's also, as we know, a significant increase in mental health issues in adolescence. Adolescence is a time when people try to become more independent and assert themselves. And it was very hard to do that in the face of COVID when children were, and others were needing to be isolating and staying at home. And it has really had an effect, not to mention loss of opportunity for schooling. So we know also that teenagers are an important source of transmission to others. They may be asymptomatic, but they can still pass it on to others. And those include vulnerable people within their family and within the community. So one of the reasons to consider vaccinating teens is that it allows for a return to normalcy, a sense of control over COVID, and most importantly, a sense of relief. And as Dr. Harrington referred to, there are many things that, vaccinated people can enjoy. Sports events, travel, especially to internationally, movies, sleepovers, graduation parties without fear of infecting others, singing. Simple things like singing are possible again once people are vaccinated and healthy. So those are some of the issues, and we know that there are many questions. So I'd like to turn it over to Paul now, and I will stop sharing my screen. I can figure out how to stop sharing my screen. And we can go on.
Thank you, Dr. Shinde. That was great. I can attest to the freedoms you get when you're vaccinated. I was at the Giants game this weekend, sat in the vaccination section, and it felt I was thrown back in time. It was a wonderful experience. Dr. Mace, I wonder if you could real quickly, there was a story in the paper today about somebody who was fully vaccinated who died. And I would like to just sort of wonder if you just take a second to talk about that real briefly, because I know there are some concerns about that story. I know there's also some very special circumstances about that individual that maybe you could share with us.
Yeah, thank you so much, Paul. So I think really the take-home message is that in Sonoma County, we have had some 100-some cases in persons post-vaccination. However, only 3 people have been hospitalized. Everybody else has been either asymptomatic or minimally symptomatic. And of those 3 people who were hospitalized, all 3 had significant underlying conditions. And of those 3, 2 recovered and were fine. And then we've had this one death. And I just want to let people know that this individual was over the age of 95 and had significant other conditions. And COVID was one of several contributing factors that resulted very unfortunately, ultimately, in a negative outcome of death. But what this, I think what people need to understand is this doesn't mean the vaccine is not effective. Again, if you look sort of countrywide, there's been about 10,000 cases that have occurred in people post-vaccination that represents less than 0.01% of all cases. And I think the median age of those 10,000 individuals is somewhere around 58. And of those individuals, about 10% were ever hospitalized and 2% died. And the median age of people who died was in the 80s. So again, we know that as people get older, they may not have the same immune systems and the ability to react to vaccinations by forming immunity. There's a lot of things that could explain this, but the take-home message is vaccination is safe and effective. We really need to get as many people vaccinated as possible. And our hearts, of course, go out to the families of all those COVID patients that have met with death over the past year. And we sympathize with all of them. But I'm happy to answer any more questions.
Yeah, well, thank you for addressing that outset. That's certainly good information. Dr. Prostowski, I wanted to get to you real quickly. You're, as a pediatrician, you're really on the front lines of this issue right now. We're wondering, what are you hearing from parents, those who want to have their kids vaccinated, and maybe some who are hesitant to do so? What are you telling them?
Thanks, Paul. Well, Dr. Shende is a pediatrician too, so we share that lovely title. Um, the parents, as you guys had said, that 25% of kids in this age group of 12 to 15 have been vaccinated in Sonoma County in like 2 weeks. It's an unbelievable rush. And a lot of the parents in my office, I feel like this age range is frequently an age range where we're talking about vaccines anyway, because a lot of kids who are as young as 11, but we continue in 12 and 13 and 14 to offer them kind of their pre-seventh grade vaccines. So we're often coming in talking about shots anyway. So it's not out of the ordinary, I think, in this age group to be routinely talking about vaccines when they come into the office. I think that it's interesting from a parent standpoint because a lot of the parents have been thinking about themselves getting vaccinated for so long. They've already kind of gone through their process, and not surprisingly, the data shows that they recommend for their kids what it is that they chose to do. Some of the parents, interestingly enough, who have said that they themselves were not so comfortable getting vaccinated, but they gave their kids the choice to make that decision. Those are always interesting cases because I'm always kind of proud of, as Dr. Shende was alluding to, this kind of age where kids they kind of want independence. And on this particular issue around vaccines, it's nice to be able to give them that choice after this horrific last year that they personally experienced by virtue of having to do schooling from home. So it's nice to be able to, for me in the office, to be able to encourage kids to get vaccinated, and also be proud of the parents for giving the kids some say in the matter. Most of the things that I hear from kids, just in terms of when I've been in health clinics in the community, I got to go to one at Wright Charter School that I think Dr. Shende, in these pop-up clinics that she was mentioning, I think with Dr. Harrington early on. They're awesome opportunities just to kind of hear what people are thinking. And a lot of the teens share that kind of same excitement that we as adults shared. I think of this kind of like, it's finally happening that we're going to be safe. But at the same time, I'm just a little bit worried about what I've heard with regard mostly, which is totally age appropriate, kids saying, I'm just worried about what's going to happen to me today, which is sort of like muscle soreness or maybe a little bit of just feeling the response to the vaccine and then anticipating what that response to the second one might be. That's mostly what I've heard from kids in this age group. Rarely have I heard anybody really aware so much or thinking so much about, I think, what both Dr. Mace and Dr. Shende were talking about with concern about breakthrough cases or concern about MISC. The kids are thinking about what's happening literally in this moment. And parents have a big role to play still in this age range. So if they feel strongly about, the safety of this vaccine and encourage their kids to get vaccinated, many of the kids are really interested. And that's been really, I feel like, encouraging. And I'm sure in many ways contributed to that incredible number of 25% in just a short few weeks.
Yeah. Well, that's really interesting. Well, certainly that rings true. Well, listen, we're going to go to questions now. I just want to remind our listeners and viewers that they can leave questions by just leaving them in the comments area in the Facebook page in which they're watching, or on YouTube, and we will gather those, or to email them to communications@scoe at sco.org. Okay, Jamie Hansen, you have some.
Yes, thank you, Paul. First, I just wanted to thank the wonderful panel of doctors we have today, as well as Dr. Harrington, for taking the time to do this. It's just a wonderful opportunity for parents to be able to ask their questions of local experts. And then I also want to thank the parents themselves for taking this time out of a busy workday evening to learn more about the vaccine and the safety for your children. So we're seeing a lot of questions come in, so we appreciate that. And for the first question, I was hoping to pass this one off to Dr. Prasowski. This is a question about the process of authorization for the vaccine for youth. There are a lot of questions and concerns about How was the vaccine approved? And, what does it mean to be an emergency use authorization? And how has safety been guaranteed for children?
Emergency youth authorization. I haven't used that one quite yet, but that would kind of make sense for this age range. Let me just say that all of us here in this panel, particularly the physicians, I know Dr. Mays and Dr. Shende and myself have all kind of signed this commitment to do no harm. So all of us are very much, as many of the adults and parents are concerned, wanting to make sure that kids and parents feel safe. And I don't think that any of us would make recommendations that we didn't have data to support were safe. So emergency use authorization is the way, it's sort of specific for the pandemic. And it's the way in which the FDA has kind of been able to make sure that given the circumstances of the gravity, as I think Dr. Shende was showing about, particularly for the elders, how significant coronavirus disease is affected worldwide, that we needed to be able to make sure that the data supported the safety of these vaccines, first and foremost, but that we weren't going to be sort of caught up in any sort of bureaucratic red tape that has held up the process at all of vaccinations in the past. And so the emergency use authorization is sort of a preliminary approach, but I'm hoping the FDA will give final permission to approve it fully. The difference between emergency use authorization, use authorization, and full approval, in my mind, I feel like, is the inability to mandate the vaccine. Once you have full authorization, you have that permission, I think, as an employer, and it's going to be curious to see how we as a country navigate that when the time comes when they get full approval. In the meantime, I think everybody is just concerned about safety. Not necessarily, I think that people are like, well, what does emergency use authorization mean with regard to feeling like that doesn't feel stable. But in the contrast, as Dr. Shende was presenting, there have been 16,000 hospitalizations for kids who are 12 to 15 years old. We just don't want anybody to get sick. We certainly don't want anybody to die. And for those 316 deaths of kids in this age group nationally, that's a big deal for us as health providers to try to do whatever we can to keep people from getting sick. So emergency use authorization is kind of like speaking in the process of getting something approved. But what Pfizer did as far as data in this age group that might help some of the parents that are like, but has there been any data for 12 to 15-year-olds? They did a study in Cincinnati looking at almost 2,300 kids. And what they did was, like they always do in science, is they look at comparing the benefits in a group that is vaccinated compared to a group that has gotten placebo. They randomized people into these two groups. They were both in Cincinnati, so in the same community. And they said, if we give you, we followed people over the course of the study to see who got coronavirus disease and who had side effects, and is there any relationship to who was vaccinated and who wasn't. And remember, the kids, again, they presumably the parents and the kids believe in science enough, so you would assume that they were going to be following public health guidelines to be part of a phase 3 trial. So with this extension, what they found was in the group of kids that got the placebo, so they did not get vaccinated, 16 of them got coronavirus disease. We didn't really hear so much about severity because this doesn't tend to be a group that has really severe disease commonly. But in the vaccine group of the kids who were vaccinated in the same community, none of them got coronavirus disease. That is striking. Like we talked about, like 95% being impressive. This was like a study that showed 100% of the people who were vaccinated did not test positive or did not get coronavirus disease. So what does that mean? When we're looking at extrapolating kind of the data that already exists with this extension of data that's specific to this age group, I think all of us as health professionals feel comfortable saying the positives of getting vaccinated are clearly outweighing the risk of getting coronavirus disease in this case. And I think that when you really are trying to do no harm, as I was saying in the onset of this, the vaccines of Pfizer, which in particular is the first one that had been approved back in December. It's been shown for at this point over hundreds of millions of doses to be totally safe and effective. And as Dr. Shende showed, particularly with that graph about the residential nursing homes, I mean, we just saw 0 cases and 0 deaths, and we just want the same for our teens.
Thank you so much, Dr. Prostowski. I think the data is really helpful. Speaking as a parent myself, I know it's very helpful to have specific information to be able to have as a starting point to learn more. So staying with this topic of safety for a moment, I think this is the really big concern that we're seeing and hearing. We're getting some questions about both the short and long-term side effects of the COVID-19 vaccine, particularly for youth, and what we know now and what we could expect, or how we are feeling guaranteed that there would not be detrimental long-term side effects. Dr. Shende, would you be able to take this one?
Yeah, so specifically in terms of long-term versus short-term side effects, that's a valid concern. We are talking about teenagers and about their future. They're just starting out. They're not even adults yet. Some of them may look like adults, but they're not quite adults yet. So of course there's valid concerns about this. And I know some of the concerns are, what happens many, many years down the road? Well, one thing we know about vaccines, all vaccines that have been released, all the pediatric vaccines that we routinely use, all of them, it's been shown that if there are significant side effects, they come out within the first 8 weeks. And this has been shown time and time again. And so the studies were done to ensure that that time frame was allowed for to evaluate the side effects. And so it wasn't even released. Pfizer, I think, was the first one, right, in December. So it wasn't released until after that 2-month period. And in that time, they did not see any concerns, any signaling. And as Dr. Prostowski mentioned, we've had these vaccines now for 6 months, and we haven't seen any concerns. So if there were going to be a significant concern, it would have shown itself. Just for historical context, there have been vaccines in the past where there were some concerns, and one notable one had been rotavirus. And interestingly, that one was released just a couple weeks before my son was born. And because it was so new, I wasn't comfortable with it. And it did have some concerns. When the data was reviewed, there was some safety issue. So it was then studied for a period of time. It was reformulated. To make a long story short, my older son did not get the vaccine, got extremely sick, had to be in the emergency room. It was heartbreaking. My next son got the vaccine, did not get rotavirus, even though it was in his school, and it made a world of difference. However, I had confidence because they did look at it carefully, and that evidence, that concern came out within a very short period of time. So that's one issue. Looking at how vaccines have been in the past and the fact that they have been safe after this period of time is really an indication that going forward, we can assure safety. And that being said, all of these vaccines are going to be followed over the next 2 years to evaluate further.
And Jamie, just to add to what Dr. Shende was saying, when we make decisions for kids, I know that it's not in this particular case as simple as saying, comparing getting vaccinated to nothing. Like, you have to kind of weigh the benefits of what's the risk of getting your coronavirus vaccine compared to getting coronavirus, because that's like the real comparison, apples to apples. And I think when you're really talking about short-term and long-term side effects of getting coronavirus disease compared to short-term and long-term effects of something that's been more reliably studied at this point, particularly in an older population, but even in a younger subset, it seems to us as health professionals a little bit more obvious that the vaccines are more regulated, they're more clear about what you're going to get as far as benefit compared to coronavirus disease, where there's clearly a lot of unknowns about long-term effects for people who've been sick with coronavirus disease, which is not as clear as Dr. Shende had said. With most of the vaccines that we have within 60 days, we typically know that information with all of the other vaccines that have been approved. With the diseases, we do not know what coronavirus disease will do to teens long-term.
Thank you both. I really appreciate your time on those answers. I would like to head over to a couple questions that are related to the school side of vaccines. And so, Dr. Harrington, we're getting some questions about if these vaccines cannot be mandated because they're under this emergency authorization, what does that mean for schools? Can they mandate this vaccine while it's under this type of authorization? And in general, what is the school policy around vaccines?
Well, first of all, we have designated policies for vaccines that have been approved by the state for admission to school. So those policies still stay in place. Those vaccines still stay in place. That first grade health checkup still stays in place. All the kindergarten requirements are there. And if you're planning to register your child for school, you should still get those required vaccines. Now, the next situation is for the COVID-19 vaccine, it is not going to be a requirement because of the authorization process. Now, we were talking earlier about whether the state will mandate that once it goes through the formal clearance process. I don't know. That's at least a year and a half away. And so we don't know about that. So, but one of the biggest advantages is for schools to open in the fall, there are three pillars the state's looking at. A vaccination rate of 70%. Schools will still need to maintain some system of contact tracing. What that will look like and the number of groups they can have interface with will be somewhat determined in the next set of guidance. And they need to have, besides contact tracing and the basic, we anticipate there will be some form of masking for lower elementary grades. And the reason for that is they're not in the vaccination group. But for 12 on up, which has had the greatest displacement in education because they haven't had their regular school schedules and have had probably their greatest, how disappointing it must be to be a junior or senior and not have your prom and not have your events that make your school so special. That will be, you will have the greatest opportunity to participate in those events if you're vaccinated. You put yourself at risk by not being vaccinated, and you may put others. And of course, then there's the quarantine process. So if vaccinated, you can opt out of that quarantine process. So there's a lot of hope and opportunity for students. So we're really encouraging every parent with a child between 12 and 18 to get vaccinated, because that's the best opportunity to create a normal school environment for students.
Thank you so much. I think that message of hope and opportunity is a very encouraging one right now. And I wanted now to go to our media partner, Phil Barber, who has a question for Dr. Harrington. Phil, go ahead.
Thank you, everybody. Dr. Harrington, I just wanted to be clear on how you view the vaccination issue in terms of further school reopening. When you just talked about some of the parameters the state is looking for, but when school starts up again in the fall, do you anticipate that vaccination rates and the other measures you discussed will have a tangible bearing on whether schools are fully in person or going with a hybrid model? Are they tied that closely?
No, what the situation is this: schools will be open in the fall and they will be in person as long as we can keep out of a surge effect. If the surge comes into effect, then then all the requirements and restrictions come back. That's why it's imperative that we get students vaccinated, so that we can sustain, create the safest environment for full instruction. And I will tell you that we have about 85 to almost 90% of our teachers are vaccinated. And that is a big plus for keeping schools open. And I'm so proud of what our nurses did for that opportunity. But we anticipate a full reopening of school. There will be some health restrictions in place. Dr. Mace, Dr. Shindy, and I meet weekly, and we anticipate those guidelines coming out in July. And for those parents who are sending their students to summer school and summer enrichment camps, all the current COVID safety plans that schools have adopted stay in place. they run through, even though the masks may come off for adults, they don't come off for students, and they will stay in place while school is operating. And then we'll see what the new guidelines are in July. They'll be less restricted than they currently are, but there will be some guidelines, and that's for safety purposes. We want to have a normal school environment as much as possible. So I hope that answers your question, Phil.
Yeah, it does. Thank you. If I could ask one quick follow-up question, the percentage that you mentioned for teachers being fully vaccinated, do you have similar data for school personnel, campus personnel who are not teachers?
That when I use that number, Phil, that is all school employees.
Oh, okay.
We did not separate. We call it, when we ran our vaccination clinic for 17,200 people, that included everybody from the groundsman to the principal to the superintendent. They were all in that pool group. And that's our current rate. The last time I checked, it was 87%, but I haven't checked for a while.
Great. Thank you very much.
Okay, thank you very much. We have gotten some questions about how to access vaccine clinics, especially ones at school sites for families who are interested. So I did just want to encourage anyone who's interested to visit sco.org/vaccines or socoemergency.org/vaccine for the latest information on local clinics. But Dr. Harrington and Dr. Shende, is there anything you would like to add about the best way to access a local clinic?
If I may, best way is, as Jamie mentioned, going online or just walk in. So we've made these clinics as easy as possible. We've tried to have them in locations where people are very comfortable going there. Children have gone to Sonoma Valley or to Petaluma, McDowell Elementary, or to Elsie Allen. It's in the neighborhood. And also we've made it as easy as possible. So you can just walk in and get the vaccine. It's a trusted location. It's a place where many people identify. You might go there for not only school, but also just to play basketball or go to a sports game, etc. So we are trying to make it as accessible as possible for everybody. And as Dr. Harrington mentioned earlier, it's not only for the teen, it's for the rest of the family as well. So we know how difficult it has been for families who have kids in school to be able to take time off from work and to just shuttle kids around. So we're trying to make it as easy as possible. So anybody can come to get vaccinated at the same time.
And I would, for our second language speakers, we have interpreters on the school site settings. Each of the schools have their, what we call we have acronyms in public education, like most people. District second language learner committees are basically our ELACs and DLACs, district and local committees, and they are out there trying to facilitate and bring parents in. And I want to thank them for their dedication and support and commitment to this. Just like we had over 450 volunteers in our teacher clinics or educator clinics, coordinating that, people that were community members who felt the need and wanted to activate and get schools reopened. So we're very, very thankful to all the volunteers who have helped these clinics be successful, because the success rate we have is built on the community working collectively together.
Oh my goodness. I just want to, I know that I'm not in SCO and I'm not formally in the public health department, but can I just say as a community member, thank you to you guys. This, like, I know I'm supposed to be a speaker here, but when you say these numbers, Dr. Harrington, I mean, 85 to 90%, it's like maybe the folks who vaccinated SCO could be teaching the rest of the country how to get people vaccinated. It's like unbelievable. And when Dr. Mays and Dr. Shende are saying these numbers about how scared we were for the folks in the residential homes and how nobody has been sick or died since February, it is, considering what a lot of us in healthcare have been through. I just want to say thank you. Just unbelievable, the work that you guys have done. It makes a huge difference. And from those of us in like just the greater health community, we very much appreciate it. Joe Schmo Doctor really much appreciates it.
We want to thank you all for your incredible information tonight. And I think we probably have time for one or two more questions. Is that right, Paul? All right. So,
Yeah, that'd be good.
okay, so one question that I've seen a couple times now is a question about if you've had COVID-19 in the past or your child has, is there still a benefit to getting the COVID-19 vaccine? And is there anything special you need to know about how long you should wait to get that vaccine? Dr. Mace, would you want to take this question about for people who've had COVID-19 before, should they still get the vaccine?
Yeah, absolutely. Thank you so much. And the answer is yes, you should get the vaccine. That's a recommendation from CDC, CDPH, and from the county. And you may ask why, because we don't know if you've been infected with COVID, what kind of immunity or protective antibodies you might have and how long potentially they may last. We do know people have gotten reinfected. We have, I think, better data to suggest that the vaccines are quite effective. There are different mechanisms, clearly, than when you get infected initially with COVID. So short answer, yes, absolutely, you should get vaccinated. And I'm going to ask Dr. Shende, Dr. Patowski, if they want to jump in and add anything else.
Yeah, I'll just add that, so in terms of when one should get vaccinated, once one is clinically cleared of COVID, which in most cases is 10 days. In some cases, if people are on medications that might take longer for it to be cleared from the body, then they should speak to their provider about that. If one has had monoclonal antibodies or other higher level treatment, then they should wait for a longer period of time. But that's a very small number of people. The other thing I'd like to add to what Dr. May said is that also it seems that the antibodies that are produced, especially in adolescents, seems to be quite robust. In fact, the study showed that 1.5 times more antibodies were produced in this age group as compared to in adults. Also, getting that second dose is extremely important. Some studies have shown that once you get that second dose, that activates not only the antibody levels and the neutralizing antibody levels, but it bumps them up. And in addition, it might stimulate the other arm of the immune system called the T cells, which are memory cells. So that entire constellation of immune reaction is activated when one gets both doses. So it's extremely important. I know there's a lot of talk out there that, oh, well, if you just get one, that should be enough. You don't need to get the second one. No, with the second one, that's going to really boost the immune response and protect even more. There's also a lot of concern about that second dose. If I may just add one thing, I know there's a lot of worry out there, and it's true that that second dose, there does seem to be a little bit more side effect. I think it's important to keep in mind that if one actually gets COVID, it stays in the body for 1 to 2 weeks. And that virus then can go throughout the body and affect so many different organs. If one gets the vaccine, it stays in the body for literally a couple of days. And the side effects might last for 48 to 72 hours. And many, many studies have shown, and now we've seen over time that that's the case. On day 2 or day 3, the side effects are gone and it leaves the body. So there's a big difference there. And the side effects, if one gets it from the vaccine, it's actually a good sign. It means that the body's producing antibodies and is going to be more effective at fighting off that virus if one is exposed later on.
And Dr. Shende, have you mentioned that other immunizations can be given at the same time? If you wanted to speak to that real quick.
Thank you. Yes. So last week, the CDC changed the recommendation such that if one is getting the COVID vaccine, then simultaneously at that same time, one can also get some of the other teenage vaccines, such as the Tdap or the HPV or the Menactra, or any vaccines that have been missed because of having to stay out of the office, et cetera. That being said, there have to be 2 weeks after that to get any other vaccine. But yes, so more than one vaccine can be given on that same day.
I think, Jamie, one more piece that to add to what Dr. Mason and Dr. Shende are saying is that when you get coronavirus disease, it's a particular variant. And what we've noticed is that for some reason, I don't know if we necessarily know the answer to this yet, but the vaccine seems to be more broad coverage against different variants, even though it's one vaccine. So when you get infected against, like recently, there have been California variants that have been the predominant ones here. That may protect you pretty well, I hope, against that particular variant moving forward. But over time, and we're traveling, and people I know I think have been having a close eye on India and South Africa and Brazil, I would want to know that I have the most protection against any variants I might be exposed to. And the vaccine seems to be the best coverage broadly for variants, just to add to what my colleagues are saying.
Thank you. I appreciate that. That was something that I was not aware of. That's very helpful to know. And so I think we may have time for just one more question. And I thought a good one to end it on might be a question that we received from a community member about how long does the protection from the COVID-19 vaccine last? Do we know that yet? And will people be required to get booster shots down the line for the COVID-19 vaccine? Dr. Shende, could you take this one?
Sure. So the studies are still ongoing to determine how long those antibodies last. We know that they do last for at least 6 months, but that's because that's how long the vaccine has been available. Studies are underway to see how much longer it's going to be lasting the system. So the big question is, okay, is a booster going to be required? And jury's out. We don't know at this point. The Pfizer, as well as Moderna, and I believe Johnson & Johnson are all doing studies to see whether boosters that are tailored specifically against the variants might be effective against those variants. But there's no hard and fast answer as to whether a booster would be required. If it is required, then it would be necessary a year after the first dose of the vaccine. I don't know, Dr. Prostowski, if you have anything to add to that?
Yeah, no, I don't know if it's hard to answer questions about like a long-term one. We're still kind of only at this point, what are we, 15 months, I think, into learning about this new disease. One thing that's fascinating, Jamie, just to speak from a primary care standpoint, is that this has been such a unique experience for a lot of us as physicians and health professionals, in that typically we have much more experience and information to offer our parents and our colleagues and our friends and loved ones. And a lot of us are receiving the same information in real time. So, it's like that New York Times alert on your phone, or you're reading the Press Democrat and Phil Barber's articles, and you're like, okay, we're learning together what's happening. And I think that one of the ways in which we could kind of, as a community, think about each other's safety is to help each other with the strengths that we have to offer. So I think when somebody like Dr. Harrington says, hey, this is what, from the school's perspective, we can do in order to keep people safe, and Dr. Mays and Dr. Shende say from the public health department, this is from our perspective what we recommend to keep people safe. I feel like, as just sort of myself, a community member here, it's my role to just kind of have those conversations with people in the office and on the baseball field, and wherever it is that we see each other, and try to at least talk about that, like I said, apples to apples comparison. Like, even though we may not know how long the protection might last, we know you're safe when you get the vaccine. So we know that for now, and I hope that we'll all be told in real time how long the safety lasts, and then we'll talk about it once we get that alert on our phones. But I hope for right now, it seems at least we know it's the safest option, and we'll all learn what to do next as the information comes out.
Well, that's a great note to end on. And so we're going to end our session here. We really want to thank all of our panelists for today. Dr. Harrington, Dr. Mace, Dr. Shende, Dr. Presank, the crew who helped put this together, including Jordy, our Spanish interpreter, and Vincent, our ASL interpreter. Most of all, we want to just thank all of you for joining us today and for asking your questions. As Jamie mentioned earlier, we encourage you all to go to socoemergency.org/vaccine for more information on vaccine and vaccinations, and go to sco.org/vaccines. That's SCOE.org/vaccines to learn more about the SCO vaccination clinics and school reopenings. We also want to make sure you know that recordings of this panel discussion and Q&A will be posted on the county Facebook page and YouTube page, and on the Sonoma County Office of Education website. So please feel free to share this with your friends and family members. We and staying safe. Thank you for joining us.